I am Dr Alpesh Gandhi, past President, Federation of Obstetric and Gynecological Societies of India, practicing in Ahmedabad as a Senior Consultant Obstetric and Gynecology. Thank you for having me. It's a pleasure to be here.
Welcome, Doctor. We have a very special program lined up for you in honor of Breastfeeding Awareness Week. Can you tell us why breastfeeding is so important for both mothers and babies?
Absolutely. Breastfeeding provides essential nutrients and antibodies that help protect babies from infection and diseases. It promotes healthy growth and development of babies. It is also beneficial for mothers. It helps with postpartum recovery and reduces the risk of certain cancers in future. Breastfeeding also fosters a strong emotional bond between mother and child. Firstly, the act of breastfeeding releases oxytocin hormone, which is often referred to as the love hormone, which enhances maternal bonding and feeling of love and attachment. Secondly, the close physical contact and skin-to-skin touch during breastfeeding promotes a sense of security and comfort for the baby. Thirdly, the eye contact and interaction between mother and baby during breastfeeding strengthen emotional connections and communication. Lastly, the regular and intimate interaction helps in recognizing and responding to the baby's need more effectively, further deepening the bond.
What is the ideal duration of breastfeeding? For how many months should a baby be breastfed?
As per the WHO, World Health Organization, it recommends exclusive breastfeeding for the first 6 months of life. After 6 months, along with the introduction of soft foods, breastfeeding should continue up to 2 years or beyond, as it provides essential nutrients and strengthens the immune system.
How would you describe the current breastfeeding scenario in India?
In India, breastfeeding is a common practice, but still there are significant challenges. Ideally, it should be started from the first hour of the life or at the earliest after birth, but in many cases it is not followed. While a majority of mothers initiate breastfeeding, exclusive breastfeeding rates for the first 6 months are lower than expected. This is due to various factors such as lack of proper knowledge, misbeliefs, inadequate support systems, and societal pressures.
Thank you, Doctor, for these valuable insights. Any final message for our listeners?
Of course, my message to all the mothers to start breastfeeding at the earliest after the birth of their babies. I also encourage them to learn proper methods of breastfeeding and information about breastfeeding. It's one of the best things that you can do for your baby's health and your own well-being. Let's work together to create a supportive environment for breastfeeding everywhere in India, wherever it's a home or it's a public place or a workplace.
Dr. Alpesh Gandhi, thank you, Doctor, for your message.